If you're turning 65 this year and you are planning to continue to work, I need you to listen to me. Just because you're still working does not mean that you can automatically delay your Medicare Part B without penalty. I had somebody who came to one of my Medicare seminars recently, and his question was probably one of the best ones I've heard in a long time, and it made me make this video. His question was, well, if I am working, right, and I'm working consistently, but my insurance that I have is retiree coverage from another job, another location. Does that mean I could still, right, delay my Medicare? If you don't know this, two things have to be true in order for you to delay your Medicare without penalty. You have to be actively working. Technically, that was a check mark on his box. The second thing is you have to have credible insurance from that employer. The second one sounds like, well, if I have retiree coverage from an employer, then technically I am covered by an employer. But your job is not with that employer. Who you're currently working with, who you're actively employed with, is not who is covering you. So the answer is to the question, if I'm getting my health insurance from a different company through my retiree benefits, doesn't that still count as creditable coverage? Can't I still delay my Part B? And the answer is no. And the reason why is because when Medicare is deciding whether you can delay Part B without penalties, they are not just asking you, do you have insurance, right? They're asking you, is that insurance based on your current active employment? Right? And that is a big difference that I don't want you to miss. If your coverage is coming from retiree benefits from another job, Medicare does not treat that the same as active employer group coverage, and therefore giving you a moment to delay your Part B. Retiree coverage is not considered coverage based on your current employment. Right? It's not considered current employment coverage. So even if you're still working somewhere else, if your insurance is not actually tied to that current active employment, then that will not protect you the way you think it does. And that's where a lot of people get caught up, right? Because on paper, they'll think, I'm still employed and I got insurance, so I'm okay. Medicare looks beyond that. So this is exactly why you don't want to do any guesswork through your Medicare time. I'm so glad that that person came to the event. I'm so glad that we sat down and we were able to get on the phone afterwards and he asked that question, because one misunderstanding can turn into a late enrollment penalty or a gap in your coverage that you were not prepared for. So if you are turning 65 and you're working and you're half retired, or you're just piecing the coverage options together to see what my situation could look like, get it reviewed before you make a decision. That's what I help you do. So comment, review if you want any assistance with this and making sure that you get this right the first time and you avoid all possible penalties.